Hi, my name is Jennifer Fellmeth, and I'm the coordinator of the NeuroRehab program here at Southern Indiana Rehab Hospital. NeuroRehab is a specialty outpatient program whose focus is on treating individuals who sustained an acquired brain injury and help them relearn higher level skills and enable them to previously held roles of driving, school, work, and community reentry. March is Brain Injury Awareness Month, and the theme from the Brain Injury Association of America for their 2018-20 campaign is Change Your Mind. As a way to increase public awareness, I wanted to share some statistics with you. An acquired brain injury is not a term used to classify a disease process that is hereditary, congenital, progressive, or brought on by birth trauma. It is something that does happen after you are born. More than 3.5 million children and adults sustain an acquired brain injury each year, but really the total rate is unknown. To just give you a comparison in regards to cancer in 2018, there was an estimated 1,735,000 new causes of cancer that are diagnosed in the United States, which is less than half of brain injury. Typical causes of acquired brain injury include electric shock, infectious diseases, lightning strikes, near drowning, oxygen deprivation, stroke, seizure disorder, substance abuse and overdose, toxic exposure, trauma, and brain tumors. Now, one type of acquired brain injury that many people are familiar with is traumatic brain injury. That is a trauma caused by an external force. For example, would be a gunshot wound to the head, an assault, a car accident where someone's head hits the windshield, and in the military, blast injuries from IEDs. The number of people who sustain traumatic brain injuries but do not seek treatment is really unknown. We can only count the people that actually make it to the emergency room or go to their physician's offices for some assistance. The annual impact of traumatic brain injury in the United States is significant. About 2.5 million children and adults sustain a traumatic brain injury. When compared to another common disease such as heart disease, 735,000 people have a heart attack each year. With traumatic brain injuries, approximately 2.2 million people are treated in the emergency room. Of those 2.2 million, 280,000 actually make it into the hospital, and then 50,000 of those people die. Every day in the United States, 137 people die because of a TBI-related injury. And at least 5.3 million Americans live with some sort of TBI-related injury. The primary causes of traumatic brain injury are falls, which is like 40%. They're either struck by something, a motor vehicle accident, assaults, and then just unknown. Here at Southern Indiana Rehab Hospital, we address the long-term impact of the brain injury survivor's illness and provide a complete continuum of services through inpatient and then outpatient services like the NeuroRehab program. At our facility, patients relearn skills and develop the confidence they need to rebuild their lives.